Okay, I want to spend the rest of the time we have together this afternoon talking about schools. It is clearly the topic that's on everyone's mind. If you're a parent of a school-age child, you are probably filled with anxiety because you want to do the right thing for your kids. You probably are very eager to get them back in school, but you want to make sure they're safe. If you're a teacher, you're anxious. If you are a business person, a lot of business folks are wondering, are the kids going to be back in school? So I'd like to take the next few minutes to talk about school. Earlier in the summer, Dr. Alexander Scott and Commissioner Infante Green and I laid out for you 5 clear metrics, 5 check marks that we had to, hurdles that we had to clear in order for us to confidently, in good conscience, say to you it is safe for children to return in school. Today, I am very proud to say that every school district in the state of Rhode Island, with the exception of Providence and Central Falls, has achieved the 5 reopening metrics and has the green light from the Department of Health, the Department of Education, and me to reopen for full in-person learning starting September 14th. And it is my expectation, and our expectation, and RIDE's expectation, that that is exactly what you will do. Starting September 14th, the green light says begin the process of returning children to in-school learning, except for Providence and Central Falls. Now, I'd like to take a minute to go through each of these metrics to tell you why we feel so confident. If you recall, the first metric is around statewide data. How are we doing as a state? And I'd ask you to please put that slide up. We said in order to move forward into in-person, in-school learning, we had to be able to be in phase 3, not going back to phase 2. And as you see the slide in front of you, it is clearly the case that we are clearly, safely in phase 3. Comfortably. Look, if you look at all 4 metrics, we are comfortably in the metrics to stay in phase 3. Fewer than 10% of our COVID hospital beds are filled. That is a fantastic metric. Our new hospitalizations are stable and consistently fewer than 15 per day. Our rate of spread, sometimes called R0 or RT, the rate of spread is just about 1, which is excellent. We keep our eye firmly on that. It was quite a bit higher about a month ago, so being right at 1 is right where we want to be. And our total hospitalizations are actually decreasing. So in terms of statewide data, we clearly and comfortably check that box. Now I'd ask you to please put up the slide showing the 5 school-specific reopening metrics. I'm going to skip for a second the municipal data. We're going to come back to that in a minute. Let's go to the 3rd metric, which is testing readiness. About a month ago, I said to you, I would want to pledge to you that everyone who had symptoms in school, staff or students, could be tested and have results within 48 to 72 hours. And today I'm telling you that we have met that goal. When school opens on the 14th, we will be able to tell you that that will be met. That hasn't always been the case. As you know more than I do, we've struggled a bit with our testing turnaround time. And I've been very transparent about that. There were times when our testing turnaround wasn't where it needed to be. But it's gotten better. We've made a lot of progress. Our average test turnaround time in mid-July, it was about 5 days. Not okay. Last week, it was 1.8 days. And of course, we're doing a lot more tests. So 45,000 tests last week, average test turnaround time 1.8 days, which is, of course, obviously less than 48 hours. And as I explained, our test positive rate, on some of those days last week, less than 1%. Huge kudos and thank you to the testing team at the Department of Health and Ken Brindamore and Matt Vargas, who have worked hand in glove with Dr. King and the team at RIDO to get our testing into a better place. Thank you. We are becoming a little bit less reliant on out-of-state commercial labs, and we're doing more in-state testing, which we have a greater degree of control over, and of course you lose less time in the curry, it takes time to drive out of state. So that is why we've gone from 5 days to 1.8 days, and why I am very confident that we're going to stay there, even if testing volumes increase. For schools, public and private, we have created an entirely separate testing system in order to guarantee that we have excellent testing in K through 12. We will be establishing more than a dozen dedicated swab sites for students and teachers. And we have 10 rapid machines to test students or teachers who develop symptoms during the school day, who need immediate results within minutes. We have done this in great consultation with superintendents, principals, teachers unions. We decided after an incredible amount of thought that we didn't want to overly burden the schools or the school nurses, particularly at the get-go. So the state is handling all of the testing. Municipalities do not have to worry about it. We're starting with a dozen sites all around the state, so no one should have to drive more than 15 minutes, and we will be doing the swabbing and the testing. In addition, there'll be immediate testing with very rapid turnaround for kids or teachers who develop symptoms while in school. So when school opens September 14th, you should have confidence that we have the check mark on testing, and you'll be able to get your results within 48 to 72 hours. I am sure there will be kinks. We've never done this before, and I hope we never have to do it again. I am not going to stand here and tell you this is going to be perfect or flawless. There will be kinks that we're going to have to work through. But I am telling you that I am highly confident we have a system in place, and we are going to be able to deliver what we say we will, which is rapid testing and effective testing and accurate testing for all kids and all employees in school. The fourth metric is supply readiness. We also get a check mark here. We said in order to accommodate all students returning to school in person, every school has to have sufficient cleaning supplies and face masks and PPE. And we are in an excellent place. I need to take a minute to thank the district leaders who worked very hard. On this one, the districts are in the forefront. They, in the first instance, have to procure everything, and they've done a great job on that. Having said that, we're right there for everybody. We have your back on everything, but especially on supplies. The state's provided backup supplies to every public school, including 3,000 thermometers, 600,000 masks, 5,000 gowns, and 15,000 containers of disinfectant to schools. That's what we've already done. In addition, last Monday, we stood up the Education Operations Center, which has been functioning, to support districts with any supply shortages. So if you're a parent and you're wondering, oh, what if my kid forgets his or her mask? Well, what if the school runs out of cleaning supplies? It's okay. The school has adequate supplies, and if they run short or if there's a problem, then the state has it. We've set up a system, and we'll make the supplies available. The fifth metric is operational readiness, and this is important. This is important. So we laid out a series of questions to determine whether schools are ready to handle the reopening. It's a lot of extra work. It's a lot of extra logistics. Ask any business out there. Ask any retailer or any business. And they'll tell you this is hard work to redo your entire facility in order to be COVID ready. So the question is, does every school district have a plan that has been vetted by the Department of Health? And the answer to that question is yes. 100% of districts have had their plans vetted by RIDE and RIDO. And I want to say thank you to all the teams who've done this and to all the districts. This has been a real back and forth process. And we've all learned in the process, and we're going to continue to learn in the process. In fact, later this week, I'm going to be sharing some of the creative ideas that they've come up with because, again, there's no such thing as risk-free in the world, in anything. What we need to do is reduce the risk by being smart and having set up operations in every school, and they have all done that. Every district has a plan which has been approved by the Department of Health saying they are operationally ready. We also asked, does every plan include necessary health precautions? And the answer to that is yes. Every district's plan includes a mask wearing requirement for teachers and students, response plans for positive cases, social distancing requirements, and cleaning protocols. Furthermore, every school has a point person on testing and contact tracing, one person whose job it is, and the Department of Health and the Department of Education have been working closely with districts all summer, so we've gotten used to working with each other, and we have a rhythm of communication so we can help each other. The final question was, does every school have a plan to support students and staff if they test positive? And by the way, we know that's going to happen. We know that. We know children will test positive. We know people who work in the schools will test positive. But we're prepared for it. And so the answer is yes. Every district has a response plan that the Department of Health has approved to say that every school has an adequate plan in the event that somebody tests positive. We have some confidence in this area because we've been doing it for months with childcare. You know, for the past handful of months, we've had 8,000 or 9,000 little kids safely in childcare. And there have been cases, of course there have been cases. And so we've learned how to do response effectively and from childcare. And so what we've learned with those plans, we've offered to the schools. So between the detailed mitigation protocols our schools are putting in place and the expertise we've developed around outbreak response, we're confident that we can slow and prevent outbreaks. And obviously the Department of Health has been dealing with outbreaks for almost 6 months now. Not in schools, but in manufacturing operations, churches, within families, after a wedding, places of employment, the ACI, nursing homes. We know how to deal with outbreaks. Maybe 6 months ago we didn't, but now we have a system, and we're going to use all that know-how and make sure we keep our kids and teachers safe when outbreaks develop in schools. Another question that I am asked frequently, and it's on a lot of people's minds, is, but are the schools actually ready? So I want to address that, because I feel that. It's one thing to have on a piece of paper an excellent plan. It's an entirely different thing for it to actually be operating that way in the school. You can say you have, made plans for better ventilation, but what does it actually look like in the school? Last week I announced that we are undertaking a massive, but I believe important and life-saving initiative to inspect every single school building before it opens to receive children. And so in addition to the fact that we've reviewed every plan, we have set up a team comprised of the Department of Health, the National Guard, other members of state government who have expertise in buildings, and the team is doing a walkthrough with a detailed checklist of every single public school building in the state before any student steps foot in the door. Furthermore, we're going to have a continuous audit process throughout the year to make sure that schools are continuing to keep the facilities safe. And we're going to help them. We're going to help them. If they're not, then we're going to get the Education Operations Center in there to help them so they can be safe. I want to say this to parents and to teachers. If our team goes in there and does the walkthrough and finds it's not up to snuff, like you say the children are social distanced, but it's not possible. They have big tables, it's not possible. You say you've made provision for ventilation, but it's not good enough. Then we will not allow that school building to open. They will have to remain, the facility will remain closed. The children can learn either in another building, excuse me, in another building or distance learning until we work with the facility to bring it up to code. So I've heard from a lot of teachers who want to go back. They want to go back. They miss their kids. They know their kids really are struggling with distance learning. What they want is reasonable. They want to know it's going to be safe. So I'm telling you now, we're not going to open the school building unless our team has walked through and inspected with their own eyes that it's safe for you to go to work and the children to go to school. I want to make one note to private, independent, Catholic, religious schools, parochial schools. Based on the fact that the state has hit these 4 metrics, you are free to open for full in-person learning. Any private school that wishes to reopen for full in-person learning is cleared to do so. You are not bound by the municipal metric since you draw students from all over the state and in some cases Massachusetts. But because we've met the other 4 metrics, because we've also reviewed your plans, because you've been in touch with us, you are free to open, or cleared to open. You will be using, as you know, the same testing and contact tracing and case investigation as of the public schools. And if you need a hand, call us. If you're not sure, you need consultation, we've been in close touch with you, but give us a call. We want you to be successful. We wish you luck. Get these kids back in school. I know almost all of you are planning to go back with full in-person learning. I applaud you for that. You're going to learn a lot. It's not going to be easy, but you're doing the right thing, and I want to thank you, all of you, for your hard work. Our final metric, which is actually listed second on the slide before you, is the municipal readiness metric. And as I said, there are 2 districts, Providence and Central Falls, that don't meet the criteria for full in-person learning. We said, the Department of Health said, that in order to feel confident to return all the students in person in that municipality, we had to see fewer than 100 cases per 100,000 residents per week. Based on last week, Providence was at exactly 100. Exactly 100 per 100,000. Central Falls was at 114. Interestingly, Pawtucket, who at one point had been over 100, has done an excellent job, and they are way down to 56. So they are absolutely green-lighted for full in-school, in-person learning. Let me say this about, I want to talk for a second to the parents and children and teachers in Providence and in Central Falls. Last week, as I've said numerous times, was our biggest testing week ever. And in that week, Providence barely made it. They were at 100. I hope you feel some confidence that I don't want you to feel scared if you're in Providence or Central Falls. We are over-testing. We're over-testing in urban communities. We are specifically and strategically over-testing in Providence and Central Falls. And even at that, you're only at 100 per 100,000 cases. And 114 in Central Falls. So based on that data, even though you're in good shape, not bad shape, we want to be extremely cautious and keep everybody's health and safety front and center. The Department of Health recommends that Providence and Central Falls reopen partially and not fully in person. Now, I want to say to parents, for whom that may be tough to hear, that doesn't mean that no in-person learning can occur. It means you need to start with fewer students in the classroom. So I believe what Providence is planning to do and Central Falls is there's a focus on younger students. We know younger kids really struggled with distance learning. So they're going to focus to get as many of the younger kids in person in school as possible. There's a focus on transitional years, 6th grade into middle school, 9th grade into high school. A focus on kids who have learning differences. And even in the high schools and middle schools, there will be some in-person learning. However, the Department of Health has not cleared Providence and Central Falls for full in-person in-school learning just yet. We do plan to monitor the situation and make updates as is appropriate. In the case of Providence, we have tested more than 25% of all Providence residents. And the test positive rate in Providence is about 2%. So I do want to be clear about this. We are taking a cautious approach because we believe that's the right thing to do to keep teachers and students safe. And so we're saying Providence and Central Falls cannot go back right away with full in-person. But I don't want you to have a sense of alarm if you're in Providence. We have done an enormous amount of testing, more than 25% of the population. Test positive rate is 2% and trending in a good direction. As we bring back more college students, our test numbers in Providence are going to go up. We're going to be testing a lot more people in Providence. And so you're going to see, that number may go up from 100 to higher. And that's why in Providence, and everywhere really, we're going to be transitioning to a deeper focus on test positive, because we're strategically trying to test more. In about a month, the Department of Health will have a check-in with Providence and with Central Falls to see, would it be appropriate for them to return at that time to full in-person learning. And we're going to focus very closely on that percent positive. Right now it's not, but now isn't forever. And in October 13th, thereabouts, we will check in with folks in Providence and Central Falls and see, maybe at that time, might they be able to go back for full in-person learning. But for now, on September 14th, Providence and Central Falls will start with partial in-person. It is my hope, and I might even say expectation, that in about a month, we'll be able to do more in Providence. And I hope Central Falls, but Providence is looking like it's in very good shape. The numbers are coming down. The test positive is low. So if you live in Providence, do everything you can to keep a lid on this virus so we can get these kids back to school. So to recap, today the state, led by the Department of Health, is telling school districts and mayors and school committees and principals, you have the green light to open September 14th for full in-person school. And it is our expectation and hope that that is what you will do. Obviously, just because you have the green light doesn't mean you need to step on the gas and go fully on day one. We hope and expect that you'll proceed with caution. Some districts are going to proceed faster. Other districts are going to have a bit more of a cautious approach. And we think that's fine. We think that's appropriate. We're saying open as much as you can beginning September 14th. And many of you are going to take a staggered approach, which we feel is fully responsible. I'd like you to please put up a slide that goes into the phasing that we suggest and that we expect. School starts September 14th. You all have the green light for full in-person learning, except Providence and Central Falls. That, for parents out there, that does not mean all of your kids are going to necessarily go to school in person full-time starting on the 14th. It's going to take some time. There'll be staggered starts. There'll be, some kids might go in for the first 7 days and then do distance learning for 7 days. You know, I would ask you to have some patience with principals and teachers and us as we try to get this right. We think it's going to take us about a month between September 14th and October 13th before we get everybody back in school in person every day. So please bear with us for that first month. Every child should have some in-person learning, but it's not going to be everybody all at once on the 14th. We're going to ease into a full reopening between September 14th and October 13th. And you'll see from the slides before you what we are anticipating. Just like everything else in our lives, school will look different. Your kids are going to have to wear masks. You cannot send your child to school if they are sick. You cannot give them a little Tylenol if they wake up with a fever and send them to school. And I'm talking to myself here. Every mother and father has done it. We can't do it this year. There'll be new hallway procedures, new lunch procedures, new locker procedures, new bathroom procedures, new drop-off procedures, new pickup procedures. It's all going to be different. So let's just bear with one another and be patient and kind and creative and understanding. This is why we are telling districts, offering to districts, recommending to districts, take that full month between September 14th and October 13th to start easing your kids back into school in a staggered fashion. Some schools I know are planning to bring back 1 or 2 grades per school. Just kindergartners and first graders at the elementary level, just 6th and 9th grade in the high school for the first week. Others are doing a week of distance learning before school starts, and then they're going to go in person. However districts choose to execute their phasing, we encourage them to do phasing. Let me say this. It's our expectation that you begin getting the kids in school on September 14th, and it's our expectation that all kids are in school by October 13th. So take that first month to do the staggering and work out the kinks, but by October 13th, we want children in school for in-person learning, except for Providence and Central Falls. If that's what parents want. No one's ever going to force you to send your kid to school. I've talked to lots of parents whose children have underlying health conditions, developmentally disabled, live at home with a mom or a dad or a cousin who is themselves very sick. Do what's right for your family. But it is our obligation to provide every student in the state of Rhode Island with a high-quality public education, and by October 13th, they all ought to be back in school. And I want the superintendents and teachers and students to know that you have our full support as you move forward with in-person learning. And I again want to remind you, you're not on your own. As far as I know, we're the only state in the country that has set up an education operations center. We're the only one doing the walkthrough of every school, and these are intended to make you feel a little bit safer. Also remember, we're not going into this blind. I have had a lot of people send me photographs of what's happening in Florida and Georgia, and I agree, it's scary. I'm not going to try to pretend it's not scary. It is scary. That's not where we are. We have a test positive rate of 1%. We're testing more than any state in the country. We've dealt successfully with outbreaks. So we're going to give this a try. And like everything we've done together over the past 6 months, if it doesn't work, we'll adjust. If we have problems, we'll deal with it. But we owe it to our children to get them back into school. And for our part, we're there for you 24/7. So if you're an anxious teacher or an anxious principal or an anxious superintendent, call the operations center, tell us what you need. We want you to be safe, and we want you to feel safe, and we want you to have a good school year. I'm actually hopeful that when we come out the other side of this, our schools will be better. We're going to learn a lot. We're going to learn a lot around how to educate children, and I hope that some of the innovations that we uncover this year will stick with us. I hope COVID doesn't stick with us, but I hope next year, when we have a vaccine, some of the innovations we're learning this year will stick with us, and we'll have an even better system than next year. Final note, to our teachers, we need you. We need you. We always need you. We always need you. Most important profession there is. We really need you now. And I know a lot of you are nervous. So I'm asking you to muster the courage required to do this. I'm asking you to trust us that we're going to keep you safe. And I want you to know we are forever grateful for the work you do for our children, many of whom right now are really, really suffering. You don't need me to tell you that. You've kept in touch with your kids through the summer, and the stories are brutal. My heart breaks for them, and I know yours does too. So let's together do what we need to do to keep you safe, appreciate you, and get our children back to school. So